Brooklyn needs a hospital! Brooklyn needs a hospital!
Nurses decided to fight back. All right. We refuse to let them close Long Island College Hospital.
We will be the ones who set our future. Vote yes.
The FDR Drive outside of Bellevue was completely covered by the East River.
I'm out today hoping to help the community.
For nurses here and doctors.
I want to thank the New York State Nurses Association.
It's time to pay attention.
We care about the hospital, but they also need to care about us.
Patients first. Patients first.
When I started at St. Clair's, we did not have a union. Now we do.
We are a union, and don't you forget it!
What an incredible year we've had. Your dedication to patients is extraordinary. Your call for change is resounding. And we hear you, Albany hears you, hospital management hears you, and all of New York hears you. Let's take a look at this amazing year, a year of unity and a year of action. It started with Hurricane Sandy, the biggest storm to hit the Northeast ever. It hit us with a wallop, but you, the nurses of NYSNA, were there.
Hurricane Sandy crashing on shore, winds now at 90 miles per hour.
Sandy presented us as an organization and me personally with challenges I had never seen before, both as a nurse and as a NYSNA member and just as a human being. And it was scary. You know, seeing the water come up to the door of the emergency room and then start to encroach in the facility. Watching cars float down the street, seeing patients literally wading in water up to their waist just to get to the hospital. I saw nurses really display fearlessness, many of them coming from an area where they weren't in any danger, right into the middle of the danger zone.
The thing that will stand out in my mind is that one of the nurses called me over to the window and said, "Ann, where's the FDR Drive?" And to realize that the FDR Drive outside of Bellevue was completely covered by the East River. It was pretty dramatic. And then we started to lose power, and you know, having to move patients around so that they could have access to the electricity needed for the equipment that they were attached to then became a priority. And then when the backup generator couldn't hold on anymore, ultimately to evacuate the patients the next day or so.
New York's Bellevue Hospital Center was forced to evacuate about 500 patients on Wednesday. Several other area hospitals had been contacted about the evacuation and were coordinating efforts to provide care for evacuees.
It doesn't get more powerful than standing with some of the Bellevue nurses who effectively did the impossible when Sandy hit. That with no warning, with no power, they saved hundreds of lives under absolute duress, and they did it with extraordinary grace and teamwork. Not a single life was lost, and they deserve our eternal gratitude. Let's give a round of applause to everyone.
My shift started at 11:45 p.m. When I was driving, the water was rushing, and next second the water became up to my neck, and I was just able to get off from my car, and I had to swim to safety. Some people lost cars, some people still without electricity, but every day we are coming to work.
Families couldn't find other family members. They were devastated. They didn't know if they were dead or alive, missing, drowned. So we were constantly trying to call family members, text family members using our personal cell phones and whatever means we could to communicate with the outside world for them to calm them down.
I was volunteering down in Rockaway with Sandy.
We're going to take a look at this. So here we can see just this area of devastation.
I saw the devastation. I saw the needs of the community that weren't met. There were so many residents who didn't have water, didn't have electricity, didn't have health care, didn't have medications. I know NYSNA was very involved in getting out there and getting to these people to try to help them.
Hello, this is the medical response team. We're nurses here and doctors. We hear you have a medical problem.
When tragedy hits, such as Hurricane Sandy, it's the people who have the most to lose that lose the most.
NYSNA launched a network of RN volunteers who continued to provide nursing care for weeks following the storm on Staten Island, Coney Island, the Rockaways, and Long Island. On behalf of the Board of Directors and myself, we salute the courage and dedication of our members in the face of this devastating storm. We live and breathe safe staffing. On this critical issue, your judgment is what matters. We will not compromise patient safety. We will give no ground on the quality of care. We are determined that every hospital, in every village, every town, every city, and every corner of New York be staffed according to minimum mandatory staffing ratios. And we are making that loud and clear.
Hey, hey, what do you say? Safe staffing every day.
In May, we had probably the largest rally in New York history of nurses, registered nurses, in support of the safe staffing ratios bill.
It's time to have the right equipment, the right number of nurses to provide quality care.
There is a huge concern for the quality of care that patients are going to get. And I think nursing's job is to be that advocate and that spokesperson.
Advocating for safe staffing in the halls of the legislature was one route we took, but we didn't stop there. We brought the fight back home to our hospitals. We started with St. Charles Hospital on Long Island, where unresolved grievances and endless meetings were not getting results, and patient needs were not being met. So we marched into management.
I think we all feel so intimidated by management because they do such, they intimidate you. And I think a lot of nurses are fearful of that based on the economy these days, and they don't want to lose their jobs because they've seen some terrible things happen to nurses. So I'm hopeful that this at least spurs something in management to negotiate fairly.
You know what? I'm on a system-wide conference call, but I mean, if there's anything that I can do to help, Maureen Morris, Human Resources.
I cannot stress enough how disappointed the nurses are here in the management of this hospital, okay? And the lack of respect that we're getting from them. These are good nurses, and they've done a great job keeping the reputation of this hospital up. But we're doing it with our hands tied because we're not getting the help from management. We're just not. I don't see how somebody can go to sleep at night leaving an ER with 22 holds and 4 nurses.
Today what we did was we presented to the head of Human Resources and the VP of Nursing letters stating our concerns as far as the lack of staffing, how they're opening units without having any contingency plans, even despite us trying to get that remedied months back.
The St. Charles nurses won. Management agreed to improve staffing in the unit within days. This year in hospitals across the state, NYSNA nurses won battles for improved staffing.
We're fighting for staffing everywhere. For instance, in the intensive care unit, we want to make sure that our nurse-patient ratio is always 1:2, which is the safest for our patients.
At Montefiore, a POA campaign led to 9 new RN jobs in the ER. At Jacoby, RNs won 6 new positions in the ICU. At Kings County, a POA campaign in the ER added 50 new RNs. At St. John's Riverside, a new contract includes improved staffing ratios, and the fight for safe staffing goes on. With the community, RNs at Olean General Hospital are demanding staffing ratios.
Nurses see people at their most vulnerable point, and it makes you think that I have to do something about this. I can't just allow this to happen. I can't take care of patients this way. I've got to have a staffing bill because that's the only thing that's going to really make a difference.
In Brooklyn, at Litch and Interfaith, we played a leading role.
Why close Litch? Why close Litch? Why close Litch?
Working with community allies and other unions, we stopped hospital closings. You said it. We will not abandon our patients. We will not leave our communities. We will never give up this fight.
1, 2, 3, 4. We won't let you close our doors.
We want to send a message clearly to the politicians, particularly to Governor Cuomo and all those who have mismanaged healthcare in Brooklyn, to stop messing with Brooklyn healthcare. Stop messing with Brooklyn healthcare.
We went to court in Brooklyn to stop the closure of Litch.
This is a fast-growing area with population-wise, and there's no hospitals around, so people will die if they don't get to the hospital quick, unfortunately.
What we argued in front of the court was that they basically allowed the State Department of Health to approve a closure without regard to the needs of the community.
Save Litch! Save Litch! Save Litch!
I think NYSNA's had an incredible year. We've, for the first time, stopped hospital closings in New York City.
And as of this moment, this court order is in effect, which requires care to continue at Litch.
I love this hospital. My husband had surgery. I was a patient here. Long Island College Hospital is open for care.
Long Island College Hospital is open for care.
Long Island College Hospital is open for care.
In Plattsburgh at Champlain Valley Physicians Hospital, where we represent all professions, RNs, pharmacists, lab techs, 800 staff, a new 3-year contract was won and ratified just last month, protecting benefits and patient care. We will fight for contracts at every NYSNA facility to guarantee fair wages, benefits, and protect quality patient care.
We know we're facing the ongoing attacks to our community hospitals and the corporatization of healthcare. We know that we're fighting for patients' lives and their access to care, and that's a fight that we can't afford to give up, and we should not. No matter who says, no, it's a losing battle. We have to continue that fight. That's what NYS is about. That's what nursing is about. We don't back down.
When a politician gets it, he or she gets our support. For the first time in the history of our union, we have made endorsements in local elections, and our backing made a big difference.
When I won the endorsement of NYSNA, it was a turning point for this campaign. It's a turning point because for me personally, this was an endorsement I wanted so badly because I had stood shoulder to shoulder with you to save Interfaith, to save Long Island College Hospital. It's an endorsement I wanted so badly because I've seen the strength and the power and the fight that you have every single day. And I said, that's what I need on my team.
NYSNA backed candidates that were fighters for the issues that were important to our members and important to our patients.
This is about more than a campaign. Provide health care to Americans.
There's a lot of work and a lot of promises to be kept, and we have to be there to make sure that those promises truly, truly will be kept.
Jill, I want to thank you and I want to thank NYSNA for having been extraordinarily strong, courageous, consistent in this fight. Let's give them a round of applause.
Bill de Blasio was elected mayor of New York City on November 5th, 2013. The politicians need to listen up. NYSNA will not tolerate corporate or bureaucratic decisions that strip communities of vital health services.
They're closing hospitals where they're sorely needed, and the private sector is moving in and they're putting in hospitals and resources in areas that are hardly impoverished. So it's a race to who can provide now the best designer care, where you get the, as part of the treatment, you get the quote-unquote cucumbers on your eyelids along with the treatment, while they're taking away services from communities that are in desperate need, but the community doesn't have money.
What happened at North Central Bronx cannot happen again. HHC closed perinatal services virtually overnight, without notice and with no input from the community or the workforce. Shame on them.
In the Bronx this year, we saw an entire unit at NCB Hospital shut down, and that's absolutely wrong, and it needs to stop. We need to draw another line in the sand.
And we did just that. With the community and other support, we fought for the reopening of perinatal services at NCB and won. We are pressing our demand that the reopening cannot wait.
Our public hospital system works on the premise that nobody is turned away. Nobody is turned away simply regardless of place of origin, regardless of ability to pay, simply regardless. And it's that expectation that everyone has equal access to care that NYSNA is also based upon as well.
Shame on Continuum. They shut down pediatric and detox units at St. Luke's Roosevelt one day, merged with Mount Sinai the next. We say, beware of unequal health care in New York City, now known as the inequality capital of the United States.
The powers that be do not represent the interest of the general community. They're interested about the almighty dollar. And I think that that's the reason why we're seeing shifts from areas of need to areas of greed.
Some people believe that they should put profits before patients. And that is exactly what we do not believe. We believe that patients should come before profits.
The outsourcing and privatization of healthcare must stop. We all know what happened at Westchester County Medical Center. 140 jobs outsourced, and now private for-profit staffing companies fill those ranks? We won back 40 jobs, but we demand the end to the outsourcing and the full protection of patient care.
We are under attack. The hospital laid off over 140 nurses back in 2011.
It was mass chaos. It was just absolute chaos.
Management made a decision that they didn't need these people as full-time staff members.
Over the past year, we've won back about 50 RN positions. It's been a hard-fought battle. We've had nurses fill out their protest of assignments like clockwork, and we've had over 4,000 POAs.
We have sent these protest of assignments to the Board of Directors. We have sent them to the Department of Health. We have sent them to the Department of Mental Health. We have contacted our local legislators. I myself went up in front of the Senate in Albany to make them aware.
And I think that has prompted management to wake up and go, we have a problem here. We've been NYSNA for a long time, and we've held the NYSNA banner here for a long time. And we've been able to make a lot of changes professionally here because of NYSNA.
All year, our nurses at Saranac Lake fought a battle. It was to stop the downgrade of the Lake Placid Emergency Department at Adirondack. We won with the critical support of a community coalition. The communities are with us, but the fight is not over. 3 times. That's how often corporate America tried to open New York's hospital system to for-profit operators this year. They want to extract profits from our communities and send them to corporate shareholders. That is dead wrong.
You had all these financial experts telling the public and even telling our legislature that, you know, it just wasn't sustainable. And for us to really draw a line in the sand and take a position, and we're just not going to back down.
We took our fight to Albany. We spoke out for communities. We demanded the Certificate of Need process be upheld. We testified at state budget hearings, and we beat Wall Street and kept for-profits out of New York. The 1% are richer than ever. They're calling it the golden era of profits. It's time to get new revenue to communities being left behind, and for the U.S. to demand a tax on Wall Street speculation. We rallied with others outside the UN last month.
What do we say? Austerity? No! Prosperity? Yes! When the state shutters hospitals in the neediest communities and Big Pharma controls life-saving research, generating obscene profits for shareholders, but no social commitment.
This summer, non-union nurses in the Albany area were confronted with this very unfortunate fact. They are some of the lowest paid nurses, not just in New York, but in the entire country. They've now joined NYSNA, and 2 weeks ago, they went straight to their CEO at Bellevue Women's Center to tell him.
My name is Carol Ann Lemon. I work at Ellis Hospital, the former St. Clair's. I'm an elected leader of the New York State Nurses Association. When I started at St. Clair's, we did not have a union. Now we do. I am so proud to stand here with my sisters from Bellevue and welcome them to our NYSNA union and our NYSNA family.
My name is Christine Walthers, and I'm honored to work in a truly unique place known as Bellevue Women's Center. And I am very excited to improve the future of our patient care at Bellevue by joining the New York State Nurses Association.
In December, the vote came in with a resounding win for NYSNA, 84% for the union. The movement that we built this year culminated in one of the largest conventions in NYSNA's history. It was opened on the steps of City Hall in New York City.
Right now, we're starting the New York State Nurses Association Convention here in New York City at City Hall.
Whether you're young or old, whether you're from Queens, Brooklyn, Manhattan, the Bronx, we are all nurses. We all need respect. And until we get the respect that we want, we will not remain silent.
We are a force to be reckoned with. Healthcare for everybody is the way to go.
Welcome, NYSNA! Are we going to stand up for respect for nurses and patients?
The crisis is we do not have safe staffing. The crisis is that it is hard to work with scant resources. The crisis is that it is hard to provide the safe, upstanding care that our patients expect from us or that we expect to provide for them.
We want to make sure that the workers in the Health and Hospitals Corporation, the largest municipal hospital system in the nation, is given the respect that it deserves. If they ever funded it the way they should, it would be the model for the nation.
New York unions are still together. We are strong.
We will stand together, and we will march together. We will fight together. We will picket together.
We're not going to disrespect the nurses and the union workers any longer.
You guys inspire me. You inspire all of us from the City Council. You inspire us every day because you guys, you know how to fight.
Hello? Is NYSNA in the house? The money makers want to think about the bottom line. And what we want to tell them is what they're going to have to look out for is the picket line.
Good morning, NYSNA. You all really are a beautiful sight out there. And not just beautiful, but powerful.
The work that NYSNA has done, that the nurses have done, that you have done on behalf of all New Yorkers, on behalf of me and my family, and my constituents and their kids is nothing short of extraordinary, and we are in your debt.
I want to say from the bottom of my heart, for myself, my families, and also everybody in New York, thank you very much.
Management may try to divide us, but sisters and brothers, the time is now for us to stick together. And we are going to show the powers that be that we will unite, we will fight, and we will be here long after they're gone.
I will be so honored to remember that you, the people who make NYSNA strong, you are one of the reasons why my election would be possible.
Over 1,000 members attended convention plenaries and workshops.
People are excited, people are mobilized, they're organized, they're energized, and they're ready for the fight to protect our health care.
We've moved beyond the line of defense. We are on the offense. We are on the front lines of battle for safe communities and safe and healthy families.
NYSNA is on the move. We know the battle for quality care is a big one, but with unity and action, we can win. We can't go back. We must move forward. Our patients deserve no less.
Between Sandy, between nurse-patient ratio, safe patient handling, we're hitting it from all fronts.
It's a great time to be a member of NYSNA. I have not seen so many things happen in such a short period of time. I'm so proud to be part of this organization and all of the things that it's done.
I believe that our union is come leaps and bounds. We're definitely making progress and heading in the right direction.
We've learned how to stand together and fight for the things that are right for not just the nurses, but our patients.
I'm proud to be a member of NYSNA. I like the new NYSNA, the new organization, the way it's headed, and involving nurses at the bedside to become involved in their organization.
We know what we're asking for.
and we know what our patients deserve, and we know what's safe patient care.
I think that NYSNA has changed their direction. I think that NYSNA has realized that it takes a lot of energy and effort to make change and to be visible.
You don't get change unless you have a group of people that are unified and focused on a goal. And if that goal is the best patient care that one can get, then you have to be out there saying that.
Message to members is to try to unify and to be one strong voice for nursing and for our patients.
I think we've had great outcomes. We've seen how we've been able to bring the community together, bring some of our elected leaders together, and even other unions.
Can we trust the politicians? That's not always the case. Can we trust the doctors? We're hoping that they've taken that oath just like the nurses have taken that oath. You know, we will do no harm, you know. But we need the nurses who've always been trusted to be that safety net.
It takes dedication, it takes compassion, it takes your heart and your soul to be a nurse today.
Oh, caring for sick people. That's about the best thing that I could ever do with my life. I would not exchange it for anything else.
The big lesson for this past year for all of us is that we have one united voice, and that one united voice can truly make change.
Our role is to help people to realize that they can actually change their conditions, whether they are conditions that they work under on a unit, or conditions in their neighborhood, or conditions in their state, in their country, or in their world, because everything is related to everything else. Our job as a union is to help people make these connections, to allow them to have a space for their voices to be heard, for their actions to have meaning, and to defend their right to practice safely and in the best possible circumstances, so that they can do the thing that we all were taught to do, which is to take care of our people, take care of our society.
I am who I am, a nurse.
We are a power to be reckoned with.